Welcome back to LipidCurious. I'm your host, Dr. Vishnu Priya Pulipati. As much as I love lipids, there are moments when the spark fades. And when that happens, I personally turn to stories. Listening to how others navigated uncertainties, pivots, and long careers reminds me why I started. Dr. Thomas Dayspring. He has been a physician since 1972. He trained as an internist. He made a deliberate shift in 1980s towards the study of lipids and lipoproteins with a particular focus on midlife women. He was the first physician to be certified in both lipidology and menopause practice. He has received some of the highest honors in lipidology, including the National Lipid Association's President's Service Award and the Foundation of FNLA's Clinician Educator Award. Dr. Dayspring, welcome.
Well, I'm very happy to be here, certainly because I've loved what you've initiated with your LipidCurious.
That is so kind of you to say that about LipidCurious. What an extraordinary journey you had. When you look back now, what's something that didn't seem important at the time, but ended up shaping the trajectory of your career in a meaningful way?
My mother, as she grew up, she wanted to be a nurse. Her parents couldn't send her to nursing school. And she had some nursing books, which I discovered as a high school student. And that's where I think my brain started to think that I might want to be a physician or something in healthcare or so. And at that time, they were requesting, well, you pick a major. I just put down, well, pre-medical. I want to be a doctor. And bingo. So those simple nursing textbooks that just the human anatomy fascinated me so much is really how I wound up ultimately in medical school. Obviously, growing up as a little boy whose dad was a fireman, I became fascinated with firefighting. In fact, that's what I wanted to be. Mm-hmm. But Dad, when I was in high school, says, no, you're going to college. I so wish they were still alive. They've been so proud of me for what I accomplished during their lifetimes. But I know they're looking down from above, and I suspect they're very bursting with pride.
So let me ask you this. You trained as an internist, but in 1980s, you made a deliberate shift towards lipids, long before lipidology was even defined as a field. Internally, what told you it was time to pivot rather than stay the course?
It really goes back to my early years when I became a physician in 1972, and then there was a 3-year residency. I did become fascinated with cardiology because at that time, although the concept of preventive cardiology did not exist, lipids, the only thing we were measuring were total cholesterol and triglycerides, and we had no concept of what it meant when they came back abnormal, and the reference ranges were far worse back then than they are now. Coronary angiography developed then, as well as the first time hospitals were initiating coronary care units. And I just couldn't believe that, man, they're sticking tubes up people's arms and injecting dyes into their heart, and I can see their heart beating. It blew my mind. And then, of course, the coronary care unit was, you're bringing people back from the dead because acute coronary syndrome treatment was not terribly good back then. So there was one crisis after another, but it was where you really learned under fire to think rapidly as both a medical student and an internal medicine residency. So I just became fascinated with coronary disease, even though the mortality was horrific back then because there were no treatments. Mm-hmm. So I just started studying atherosclerosis, and mostly it was a hypertension approach. But then the lipid world started to evolve in the 80s. And the reason I jumped on it in the 80s is our first clinical trial came down using bile acid sequestrants that lowering LDL cholesterol resulted in reducing heart attacks. So I said, whoa, we're going to have to really understand lipids. And I just dove into whatever I could find on lipids. And there was no great lipid textbooks back then. So you had to dive into journals and biochemistry I had to restudy. And it was hard studying, but I often joke that one day, probably a few years later, I woke up and I really started to understand this stuff. Mm-hmm. But because I studied it so hard, I developed the knack for teaching it to others. And that's what really changed my careers. And the little bit that you mentioned, I evolved into women's health because once I did understand that boy, good blood pressure control, good lipid control is probably going to be beneficial. My generations of docs were told, oh, don't worry about women. They don't get heart attacks. This is a men's disease. And yet I knew that wasn't true because I saw women in the CCU all the time. And as I started to talk to both men and women, I just became a lot more comfortable enjoying speaking to women who always had better questions. They wanted to learn more than the average guy up in northeastern New Jersey at that time. And I thought women were getting the raw end of the deal. Nobody, not in the GYN world, was paying attention to their heart. The internists didn't think they could get heart disease, but I did. So my study shifted, of course, remained in lipids, but to everything I could understand better about a woman's health. And what stage of the game does this really become important? The premenopausal, menopausal transition.
So, you have spoken about years of spending studying figures, pathways, learning how to explain complex ideas clearly. In a world where many of us want to impact quickly, we want to do it right now. What did those quiet years of constant education give you that shortcuts could never do that?
I think the way I taught myself, and it's just the way my brain works, is I was reading these concepts in lipids and lipoprotein discovery and lipid-related pathology. The way I best learned it was to start illustrating, drawing pictures, because graphically, my brain seems to remember concepts better than reading paragraph after paragraph. And another fortunate just happenstance in my life was at that time, PowerPoint was invented and coming into fruition. With PowerPoint, I was to develop animations that showed a lot of the complex interactions with lipids and lipoproteins, enzymes, how they invade the artery wall, how a macrophage eats them. And because of my skills, again, self-taught PowerPoint expert, I became really good at it. And so it helped me learn, but it made me a 10 times better educator because I would bring those animated PowerPoints to my lectures. And doctors, that was new at the time. They had never seen anything like that. And they all said, wow, I really understand this just by watching your little particles bounce around. So it's just another fortunate happenstance.
So, you have described powerful influences outside of medicine, your firefighter father, ice hockey, and later your work with laboratory scientists as well. How did those experiences shape the way you think and teach?
In high school, I was introduced to the world of ice hockey, but a friend took me to a Ranger game in New York City, and it was one of those seminal moments in my life. When I walked into that old arena, I just said, whoa, I got to know this. So I went home, bought a pair of skates, taught myself how to skate, and got better and better in that, just like anything you study. And before I knew it, I was playing at ice rinks, and there were only a few back in those days in men's league. And it became a dominant part of my non-medical life. I just loved hockey. When my little boy was born, he came home from the hospital. I had a hockey stick stuck in his crib for him to imprint. And he went on to become a great youth hockey and ultimately a collegiate hockey player. So hockey was a dominant part of my life away from medicine. To find something I like, I put every ounce of my effort into it.
I think it also highlights the importance of doing things beyond just medicine too. We all love medicine. We want to dedicate our lives to medicine and patient care. But I think what keeps us intact as a human being is also having these interests outside medicine, not just with family, friends, and colleagues, but just some things which you get lost in.
It is, and there are other aspects of my life. And one I didn't even mention to you. Both my mom and dad, both early in their life, became avid readers. My parents would go to the public library every week and come home with 2 shopping bags full of books on whatever.
Wow.
And they would read all of them within a week, and then they'd go back and get more. So deep down, that had to translate into, and I became, as an adult, and after I was done with all it, collegiate and medical school teaching, I became an avid reader, and I still to this day do. And I love history, United States history, especially military history, but I like detective novels and the oddball romantic novel even or so. So
that's amazing. So you have received some of the highest honors in lipidology and reached countless clinicians. At this stage of your life, what kind of impact matters most to you now?
All of it. You know, I guess one day I'm going to be up at the pearly gates where are you going to be admitted to heaven or not? And who's ever interviewing me is going to say, hey, Dayspring, what did you do that deserves your entry into heaven? And I think I can look back with honesty and pride in saying, throughout my life, I was a good person. I was always kind to my fellow man. But I think in my mode of operation as a healthcare professional and an educator, I have helped countless people lead healthier lives. So I hope that gets me in, please.
But I can't agree more, because your influence is just beyond the, platforms you are kind of having that influence on. It seeps through so many of us in every part of our profession. So we are so grateful for all you did in the field of lipidology and menopausal care. So for clinicians listening who feels a spark but don't know and don't yet see a clear path, what is your suggestion for the next step?
You know, it's probably much tougher nowadays than it was in my days when, we knew a lot back then, but it was a little drip compared to what we know now in both cardiology and lipidology, for goodness sakes. And the lipid pharmacology world is exploding like there's no tomorrow. Genetics were not a big part of my training, and genetics is driving everything back then. So I think it'd be harder. The one wonderful thing of my career, I told you, I started when the first clinical trial came down. And about every 5 or 6 years, another clinical trial came down, and maybe every couple of years. So I was able to master these studies one at a time as they come down. My life was just, I was the right guy at the right place at the right time. And what advice I would give to a young clinician nowadays is, find out what is interested in, and as complex as medicine is nowadays, we're all going to have one area that we like better than others, and just throw all of your effort into that.
And I agree with you. It's like, just within 24 hours, there'll be a wealth of information coming in, and it's so distracting, overwhelming at the same time to learn everything. You want to read all the manuscripts coming out, all the cool books coming out, but it can be really daunting sometimes to approach it with the information over the years. But I think my takeaway from what you told me is that, you know what, you have to start somewhere. So start at a point and slowly dig in through it. And wherever your heart belongs to is the kind of the field you want to choose. But Dr. Dayspring, thank you so much for showing us that curiosity, reinvention, and depth don't have an expiration date. I'm so grateful I got a chance to speak with you today. And this is the first LipidCurious Inspiration episode. So I'm really hoping this resonates with a lot of our listeners as well.
Well, I hope so. And I hope my passion comes through. Work hard.
I'm sure it does. I can feel it. All right, folks. I am feeling re-energized and ready for the next discussion. I'll see you back here in 2 weeks. Thank you for tuning into Lipid Curious. If today's episode resonated, consider sharing it with a colleague who could use a lot of this motivation. You can always reach out to me at hello@lipidcurious.com. Be sure to follow or subscribe so you don't miss what's coming next. Until next time, stay curious and stay confident. Signing off, Dr. Pulipati.